Good morning. I'm Councillor Lucy Hovels, the Chair of the Health and Wellbeing Board. This virtual meeting is taking place on the 21st of January 2021 and is being recorded live to the Council's website and will be available to be viewed for a minimum of 6 months. I would like to give you a warm welcome to members, officers and members of the public or media who are watching this live feed. I will move straight on to the formal meeting agenda. Item 1, apologies and absence. Jill, do you have an update of apologies, please?
Chair, we have apologies from Julie Gillen, Vicky Mitchell, Steve White and Jennifer Illingworth.
Thank you. Item 2, substitute members.
Chair, we have Levi Buckley for Julie Gillen, Sharon Cadell for Steve White, and she'll be joining the meeting around 11, and we've got Jo Murray for Jennifer Illingworth.
Thank you. Item 3, declarations of interest. Is there any declarations of interest before the meeting commences? I haven't been notified of any, but as we go through the meeting, if anything does arise, can you please indicate and we'll record. Item 4, minutes of the Health and Wellbeing Board meeting held on the 24th of November. Can we agree the minutes, please?
Agreed.
Item 5, health and social care integration, which is a standard item on the agenda. Can I ask Jane Robinson, supported by Michael Lang, to provide a verbal update, please?
Good morning, Chair. Good morning, everybody. Nice to see you this morning. I think, Chair, just since our last meeting, members of the board will be aware that we submitted a response to the Integrated Care System Next Steps engagement piece just on the 8th of January, giving feedback on views in terms of the document that was issued at the end of November last year. And I think that response has been circulated for board members to see. We've also invited Alan Foster, the ICS lead, to come to a meeting. Unfortunately, he wasn't able to join us today, Chair, but hopefully he'll be able to come to a future meeting as kind of further details emerge in relation to the integrated care system and how that's going to operate going forward. And I think locally, as I think I touched on previously, we're just looking and updating our governance arrangements in terms of integration. And I'm sure, Chair, that'll be something we'll bring back to the board in due course. And that's probably the key things I wanted to say. And I'll just hand over to Michael at that point, Chair, if that's OK.
Thank you, Jane. Michael?
Thank you, Jane. Thank you, Chair. Just on some of the more practical elements of integration, which to some extent has been interrupted by COVID. We've been working on the creation of a hospital discharge team across adult social care, the hospital and primary care, and that will be developing in the next few months. I'm pleased to say that we've now started to deploy some of the therapists into GP practices who are employed by the Trust to help GPs to prevent hospital admissions. And just a final point on community services, Chair. As you know, the community services staff, predominantly district nurses, have been helping the GP practices with the vaccination programme, and that really just shows up the strength of the good relationships between the community services staff and the GPs, Chair.
Thank you, Michael. Any questions from members? No questions being, so we'll move on to item 6. Andrea, can I come to you for the draft health and wellbeing strategy, please?
Thank you, Chair. So members will be aware that in March last year we provided a health and wellbeing strategy, which was a holding position for a year whilst further work was undertaken to ensure that the 2021 to 25 strategy took account of the County Durham Vision 2035, the 10-year on Marmot Review, and also obviously COVID-19, which has obviously had a huge impact on how the council and its partners deliver and commission services. And as well as the direct health consequences of COVID-19 and the national restrictions have affected lots of different areas of health and wellbeing of our residents in County Durham, which includes mental health, social isolation, changes in eating, drinking and physical activity. And with the wider impacts of COVID-19 still unfolding, there are concerns around the health of the economy, employment, education, businesses and inequalities. And working with partners, the strategy looks to address these important issues through joint action. And although we know recovery will take years, our partners will continue to work together to prevent health and wellbeing inequalities widening even further. In the strategy, we also recognise the important role our communities and residents play in working together to address the challenging issues we faced. And the work on the strategy has been led through a multi-agency development group, and that's been informed by our joint strategic needs assessment as part of our Durham Insight, which I know the board has received presentations and information on, and obviously the COVID dashboard through Durham Insight as well. The vision in the strategy of the board was agreed as County Durham as a healthy place where people live well for longer, and that's still got to be our ambition. The Health and Wellbeing Board adopts a life course approach in its priorities throughout the strategy, so recognising the importance of mental health and wellbeing, physical activity and the social determinants of health cutting across all our priorities. And just as a reminder for the board, our priorities are starting well, living well and ageing well. We've also got 6 objectives outlined as those that we feel have the biggest impact on people's lives, or where we want to be by 2025. So that's improved healthy life expectancy and reducing the gap within County Durham and between County Durham and England, smoke-free environments, decreasing overall levels of unemployment and closing the gap between the general population and vulnerable groups, healthy weight of our children, improved mental health and wellbeing, and increasing the number of employers who invest in better health at work. There are also a number of performance areas included, which we'll monitor each year of the strategy. So as well as outlining our partner approach to our people and place, we're also undertaking wider consultation through online platforms, which will take place over a 4-week period. So we've already incorporated into the version of the strategy that is attached to the report lots of feedback that we've received to date, so through the work on the vision and also through the work on the current strategy. And we also plan to consult with the Adults Wellbeing Health Overview and Scrutiny Committee, Area Action Partnerships, the Voluntary Sector Forum, Town and Parish Councils and the Learning Disability Parliament. And once feedback has been incorporated into the strategy, we'll bring the final version of the strategy back to committee for March for agreement, Chair. And if I can take you to the recommendations, please.
Thank you, Andrea. Can we agree the recommendations? But can I ask if there's any questions from members? No questions. Can I just ask how we're planning to incorporate the views of children and young people in the consultation process? I know you said the Young People's Parliament, Andrea.
Yes, Chair, now that we have the Youth Council up and running, we plan to use that forum we've got about 40 young people from different secondary schools across the county of all different backgrounds. So we're going to utilise the Youth Council, but also use the usual mechanisms as well. So investing in children, our Young Carers Network, and also an invite to obviously all members of the board. If you are aware of any other forums, with children, young people, for example, through the police cadets, then please do get in touch and we will make sure we share the information with them, because we do want, obviously, our residents and children and young people to input into the strategy as well.
Thanks, Andrea. I see Councillor Gunn has a hand up and we have another member. So I'll take Councillor Gunn's question.
It's not a question, Chair. Actually, I was going to ask the same question you asked, but that appears to be answered. And I mean, Andrea set out very clearly that the groups of children and young people who we can engage with and should engage with, and the Youth Council, which was established last year, is obviously, I think, a priority for us, because young people in every secondary school in the county are actually represented in that group. So you're going to get a wide geographical spread of views as well, which I think, and age ranges, which I think will be incredibly valuable, as well as Andrew's mentioned, investing in children and young carers. Thank you, Chair.
Thank you, Alwyn. Richard, do you have a question? I know you've made commented in the chat, but again,
No, sorry. Thank you, Chair. Yeah, no, it was just like as Andrew said, we all have a quite a pretty vibrant youth forum. I think it would be good as well, making sure that we have opportunities to engage children with learning disabilities and with disabilities as well. So if that could go out, we can all link to our systems, just as Olwyn was saying, so we get a real diverse range of voices coming into it. So yeah, it was just that. Thank you, Chair.
Really helpful and very important. Thanks, Olwyn, and thanks, Richard. We have moved the recommendations. I'll move on to item 7. Amanda Healy.
Thank you, Lucy, and thank you, Andrew. I think this presentation is really the first of how we're proposing to share some of the work that will sit under the Joint Health and Wellbeing Strategy. And I think, you know, the work that's taken place over the last year during COVID to update the strategy has been really comprehensive. So this is the first time, and I have to be honest, I think we've failed a little bit at the first hurdle when I've re-looked at my presentation, because we've still got some acronyms in there. So we'll strive to make sure that they're not in there the next time. And really this is a first go, and we'll look to board members to see how we can improve on this as the strategy becomes implemented. Thanks, Nicole. But as you know, and what Andrew's obviously just outlined, is that we've shifted our focus within the Joint Health and Wellbeing Strategy to think about it across a life course approach. And also, obviously, what we've seen in the last year is we have seen the Marmot 10-year review, and we've also seen the Marmot COVID-19 review, and we've incorporated those findings into our Joint Health and Wellbeing Strategy. And it now goes across the kind of starting well, living well and ageing well. And what we're proposing, and we'll come back to the recommendations, is that we'll provide an update, and at other times it won't be me, it'll be other people who will give an update across those 3 life course elements to the board on a regular basis. And today I'm just going to draw out a few examples of the work that's in the strategy under each of those key core themes of starting well, living well and ageing well. Thanks, Nicole. So I think, and obviously this will be very close to cabinet members and many partners around the tables hearts in terms of our work on poverty and the work of cutting the cost of the school day with a dedicated working group thinking about poverty within education settings. And obviously I think Councillor Surtees is observing the board and chairs our poverty action group, and this has been a really comprehensive piece of work, thinking about with over 78 of our primary schools, 8 secondary schools, 1 of our special needs schools and 4 of our early years settings, really trying to understand the scale and impact of child poverty. And again, going back to what Andrew's saying, underpinned by a joint strategic needs assessment, challenge some of the stigma and really support schools with practical examples to which they can cut that cost of the school day. And I think we've seen a very high number of staff that have been trained to really think about how we reduce poverty and support children and their families through these training sessions to raise awareness and to think about practical ways that we can cut poverty during the school day. And there's some examples of the feedback from staff who've been trained in terms of that work, and this will link to our wider work on health and wellbeing within our school settings. Thanks, Nicole. And unintentional injuries, we haven't talked about this a lot at the Health and Wellbeing Board, and yet County Durham is an outlier in terms of its rate of unintentional injuries, and there's been a lot of work taking place in the background really, and I think it's really important that we see this sitting under the starting well part of the strategy. So we do have a framework and an action plan in place. And during the course of 2019, and we really need to ensure that this is brought back to the fore, we had over 350 practitioners who were trained in work around unintentional injuries. A lot of our unintentional injuries are in the home, particularly for our younger children, our 0 to 4s in particular, and the use of a home environment assessment tool has been revised to reflect and think about those hazards in the home. And we've done that with obviously with our foster and adoption staff as well, housing colleagues also engaged in this work. So really thinking about how we can address child safety as part of a broader piece of work and deliver against the action. So this will form a kind of key part of the joint health and wellbeing strategy. Thanks, Nicole. And then obviously one of our board priorities right across the life course, so across those 3 areas, is mental health support. And this is just a flavour of some of our, I think in County Durham we have got some real exemplar work of within our schools. So we had obviously a successful NHS England bid for 3 mental health support teams, and we matched that locally. So that was obviously supported by funds to have education advisor within the council, children and young people support workers hosted by Investors in Children in the voluntary sector, and a emotional resilience nurse practitioner hosted by Harrogate Foundation Trust, and a parent support navigator. So a really comprehensive approach and across organisations, and in really strong involvement of young people and parents. So a real range of interventions for mild to moderate mental health issues, with links and support from our specialist services, but very much trying to do that preventative and low level support. And these teams have continued to deliver during the pandemic, and will continue to be really important. And obviously we've reshaped the work of the 0 to 25 service with a greater emphasis on mental health during the period of COVID as well. Thank you, Nicole. Then thinking about more of the kind of living well, obviously, and particularly during COVID, again, mental health has been to the fore. And what we have in County Durham is we do have what's called our real-time data in relation to suicide. So we can identify any possible clusters of suicide at a very early stage, and we do that work jointly with the clinical commissioning group. And I think what obviously you can see from this graph is that actually during 2020, we've seen a slight increase in November. Our work and our rate of suicide has actually reduced. Now, these numbers are very small, and they'll be pooled into rates. However, we did from the very beginning of the pandemic continue to do a lot of work to support mental health, to respond to any people who have taken their own lives, with support to their families, and this remains, and the Suicide Prevention Alliance has continued to meet throughout the pandemic. So again, a really important part of our work under the strategy. Thanks, Nicole. Tobacco has remained at the fore, and sadly our rates have increased slightly. We were down at about 14%, and they're now at 17%. And we continue to work closely with Fresh, and we pushed really hard. National colleagues didn't want anything to kind of interfere with COVID, for want of a better word, but we did carry out a really comprehensive campaign in May of last year to kind of quit for COVID, to support people obviously with respiratory conditions who are smoking and were going to be at higher risk. So a successful piece of work then in terms of quit for COVID. We had a new provider for our specialist stop smoking service transition during COVID, and moved from to NRT voucher scheme for smoke-free County Durham, and we've continued to try and keep our quit rates as high as possible. Thanks, Nicole. And I think the next slide, it's full of kind of bit facts and figures, and I think it possibly misses just the wealth of work that the social prescribing link workers have carried out as part of County Durham Together, and supporting residents and being that real link between primary care and local communities during COVID, and they've been a real strength in terms of their work. We can see the range of, the number of assessments that were carried out, very high percentage of those that are converted when they're having those one-to-ones with our residents, that have been converted into having a plan of action, and then assessments that then go to the next stage. So again, I think the flavour of the work isn't probably captured in the data, but we may want to revisit that in terms of specific focus on social prescribing link workers and the activity that they've carried out. Thanks, Nicole. Physical activity, and I know we'll talk about this further on the agenda, so I'll just pull out a couple of points. We do now have the development of a draft physical activity strategy. We know the huge links between physical health and mental health, and this is aligned to our County Durham vision, and it's great, I think, to see physical activity as a really core part, and it will cut right across the life course. And then we did have the healthy business framework last time at the board, and again that focus on our businesses, particularly in County Durham, again around mental health and our small businesses being really important. We're also starting to look at kind of our work around healthy ageing, and I think that will need to come back into the board, particularly as we look at the health and wellbeing across the life course. Thanks, Nicole. So in conclusion, this starts to provide an overview. I think for the board, it's really to note the report today, but also to kind of agree to this streamlined process of updating with perhaps some deep dives at certain points, as it's the first time we've done it in this way, Chair. So happy obviously to take comments and questions, and then we'll reshape this going forward.
Does any member have any questions? Any questions for Amanda? No, can I thank Amanda for outlining that in a very simplistic way for us to understand. We see the recommendations there. Can we agree the recommendations and agree to streamline the process for providing updates going forward? And with that, I'll move on to item 8, which is again Director of Public Health Annual Report. Amanda.
Thank you, Lucy. Sorry, you've got me again this morning. Thanks, Nicole. As you know, obviously the Director of Public Health's got a responsibility to write a report and the Council to publish a report, and the report was published in November of last year. It's our 3rd annual report, and it's really, obviously this year, understandably, it covers quite a lot of work that's taken place during the pandemic and focused on COVID. However, I think the team wanted also to show some of the wider work against the priorities that have been shared previously with the board, and do link back to the joint health and wellbeing strategy. So this presentation gives a flavour of those, and as ever, you know, public health and the public health team can only do their work by working with others. And I think then what we'll also see this year from Healthy Lives and Healthy Communities is the Taylor family and their community on the front there. That's starting to change to our real examples of our real and residents and communities. Thanks, Nicole. Obviously, as DPH, I've got a responsibility to really draw people's attentions to the health and wellbeing across County Durham. And I know previously at the board, we've had a presentation on Durham Insight, and I think that is becoming really our one place to go to for in both the kind of top line kind of stats, but also some of the more in-depth work that's taken place. So there's a very detailed health equity audit for cancer, for example, in Durham Insight. We've got profiles for our primary care networks and for our AAPs on there, so we can really dig into some of the detail. So I think that has really developed, and certainly there's been a huge focus on COVID in the last year, and that landing page for COVID, which is publicly available, gives a real kind of one version of the truth for our public, and which I think has been really helpful when information and data can be used in so many different ways. And yeah, I think we've also said that it's really important that not just to give the negatives in terms of our health and wellbeing, which obviously we do have some significant challenges within County Durham, but really that's wrapped around by some real positives in terms of our environment, some of our services and our communities and how they interact to really protect health. And we'll continue to try and build that in more detail to the joint strategic needs assessment and Stuart and I chair the strategy group 4, so we'll continue to build in some of those assets, and that also reflects our wellbeing approach as well, colleagues. Thanks, Nicole. Now, obviously, COVID has been, the pandemic has been with us for almost a year now. And I think there was a couple of things in the report that I really wanted to pull out, was that community response. Obviously, the update to the board on COVID is later on the agenda, so I'll pull out a couple of things that are reflected in the report. And having that joint response through County Durham together, working with our local community and voluntary sector, public who stood up mutual aid groups to support residents was really phenomenal, and I think will be a real legacy for us in County Durham through County Durham together. We also conducted a health impact assessment, and that really drew out, and obviously Andy's presenting on poverty later on the agenda, and it did draw out some of those inequalities and the impact which we will see in terms of things like poverty and mental health, and it gives us a really early insight in where we need to focus our attention and ensure that that's drawn back into our priorities for the Health and Wellbeing Board. So we know it's far from over. We're working towards the light at the end of the tunnel, and there's obviously further detail in the report on all of the work on COVID over the last year. Thanks, Nicole. These are the priorities that were set out kind of 3 years ago, and I think we've used these and we've transitioned into the life course approach for the joint health and wellbeing strategy. And all I was going to say is update on those priorities, particularly the two where we had a really in-depth look at in the annual report. The report itself gives an update on all of those other areas, including some of the really transformational work that's taken place during COVID to ensure that particularly our most vulnerable residents are reached either with our services or interventions. However, I'll give a little bit more in-depth information about the two areas, thanks Nicole, with good jobs and places to live, learn and play, and every child having the best start in life. So we know that people's health is influenced by where they live, and their access and opportunity in terms of employment, and we know that this will be a challenge for us going forward. We're hearing our Amy, half of our economic director yesterday, saying particularly around young adults the impact of COVID and employment has been great, but some great examples over the last year of ongoing work in terms of housing. And work around housing solutions and replacement boilers, and so this has been a really kind of ongoing piece of work where Public Health have worked with the CCG and with Housing Solution team to ensure that people have got access to that, and we'll build on the work around good jobs for the coming year, and again slot that into the strategy. And then as ever, and I suppose Marma helped us to revisit that, if we were going to invest time and effort anywhere, it has to be at the beginning of life. And we know that it's really important for us, and particularly for those children who are more vulnerable. And there was a very, very comprehensive piece of work, a health needs assessment with children and with special education needs and disabilities that really actively engaged with those children, their families, people who worked with them, looked at the evidence base. But then I think most importantly, you've turned that into a really specific recommendations and actions to ensure that those young people's needs are met, working very closely with colleagues in children's services. Thanks, Nicole. And so over the past year, obviously the Public Health team have worked closely with others, and we've really learned a lot from others. So working with Joanne Waller's team, the Community Action team, really on the ground work and how organisations can think about tackling housing, environmental issues, and then we can join in the public health element to that. And then one of the examples with David Jones there in terms of his new central heating system. So again, some of those wider influences on health and wellbeing which we've drawn into the strategy. Thanks, Nicole. And then, as ever, and in the report, I think what you'll see is an update on last year's recommendations. So that's the ability, obviously, to hold myself to account in terms of the work that's taken place. But these are the recommendations for the forthcoming year. And certainly one of them is to really think about that healthy ageing strategy We'll be looking at all of the recommendations with that kind of COVID inequality lens as well, but also ongoing work with businesses to really think about how they continue their work around breastfeeding and that best start in life. And I'm delighted that we'll also be seeing our schools, and we've been doing some pilot work with schools on our health and wellbeing framework. So that will be something that we look forward to sharing with board members later in the year. So thank you, Chair, and thank you, Nicole, for doing the slides for me. And I think the recommendation, sorry, is to note the report, Chair.
Okay, we do have some questions for you. First of all, we'll do the questions and then we'll move to the recommendation. Councillor Gunn.
Well, again, Chair, it's not a question. I just want to commend this report. I think that all of us around this virtual table have our own particular focus in terms of health and well-being. Perhaps I think what this report does is bring so much together that we can actually focus on in other parts of what we're doing and what our particular interests are. I think what it does as well is actually show the wealth of support and the depth of that support as well that is being put into this county. Here's a copy of my Amanda. I use this. This is by my desk, and I use it for many things because, as you know, councillors are community leaders basically, and this is what we do. We work in communities as well as doing meetings like this and various other things that we do. But what is in here, I think, is so valuable. So I don't want to take up any more time, but I did want to commend it because I think that every year, and particularly focusing upon the Taylor family, which actually I think resonates, you know, it really does actually provide that picture of what is happening in families. Thank you, Chair.
Thank you. Certainly brings it to life. And I'd just like to say thank you to Amanda and all the team in public health for the amount and the tremendous work that you do and have done in terms of the progress that's been made. So we do have the recommendations there to receive the Public Health Annual Report. Can we agree? Moves us on to item 9, which is the Better Care Fund. Jane, are you going to introduce this?
I am, thank you, Chair, and I know the board have received previous reports in terms of the Better Care Fund, and this is just really to update the Health and Wellbeing Board on the plans for 2021 following the announcement in December last year of the Better Care Fund policy statement. And essentially within that, we've not been required to submit assurance plans for this financial year. And the recommendation was that we should roll forward the schemes that we had within the 1920 arrangements for the fund. And in paragraph 12 of the report, Chair, members can see the outline of the national conditions previously for the fund. And paragraph 16 outlines the various work programmes that have previously been through the Health and Wellbeing Board. So the recommendation, Chair, is very straightforward. This is just really to note the contents and ratify the continuity of those schemes outlined at paragraph 16. And we'll bring through an update to the board once we get the outline for 21-22, Chair.
Okay, you've heard the recommendations from Jane. Can we agree the recommendations? Do we have any questions? Can't see any. So with that, I'll move on and go to item 10. Can I give a warm welcome to Councillor John Robinson and Stephen Gwilym, who's going to present the overview and the key findings with the recommendations from the scrutiny work that's been undertaken. I hand up straight to you, John.
Thank you, Councillor Hovels. Just two things Lucy. Sorry, three things, Lucy. One, I moved during Amanda's presentation to do exactly what Olwen did. I went straight to my copy of Amanda's report because I've quoted it several times already this week, and in fact lectured ministers at the Home Office with Fire last week that to make their documents more alive, they should use Amanda's Taylor family. So I too have my copy at hand and went for it. Chair, Jane mentioned the ICR. Can I advise you that we also have responded as a scrutiny committee, and Durham also host and I chair the Southern, what was that transformation partnership. So we have responded also on behalf of 8 authorities in the south, including North Yorkshire. So Durham have responded as a whole. And finally, just for those members of your board who will be attending our scrutiny committee, sadly, we will no doubt be around 100,000 deaths when we meet in a fortnight's time. So we will be beginning the next scrutiny committee with a 2-minute silence and prayer for those who've lost their lives. So those members of the health service who join us, it's just as a prior warning. Chairman, as chair of the Adult Health and Health Being Overview Scrutiny Committee, I'm presenting to the Health and Wellbeing Board this morning the Scrutiny Review Report into the general practice services in the County of Durham. The review was undertaken in following concerns about potential cumulative impact. A number of proposed applications to review, merge or close GP branch services across the County of Durham. Today I have with me Principal Scrutiny Officer Steve Gwilym, who worked tirelessly on the report, and we thank him. The OSC agreed terms of reference are detailed in paragraph 3 of the report and include the roles and responsibility of the National Health Service of England and CCGs and commissioning GP services, the extent of GP coverage across the County of Durham, the current process for monitoring GP services and ratings by the CQC of GPs in the County of Durham, workload and demographic pressure impacting upon availability and access to GP services, patient feedback and satisfaction with GP services in the County of Durham, work proposed and initiatives considered by the CCG and general practice to address workforce pressure and recruitment, training and retention of general practice, the Council's role in developing and delivering sustainable transport solutions to access GP services. The working group met and received evidence from North Durham and DDES CCG, the North East Ambulance NHF Foundation Trust, the Care Quality Commission, County Durham and Darlington Local Medical Committee, DCC's Public Health, Planning Policy and Transport teams, the NHS England's 2018 GP Patient Service, and reports by County Durham Health Watch into care navigation, and access to GP services survey and the GP enter and view exits. The key findings of the review are set out, Chairman, in paragraphs 6 to 30, which have informed the proposed 9 recommendations. These 9 recommendations have been presented to the CCG as well as the County Council Cabinet. A service response from NHS County Durham CCG is also included in the report at paragraph 31. Therefore, Chairman, the recommendations are recommendation 1 and 2, the provision of NHS long-term plan, the development of primary care networks, and the proposed level of investment to improve and increase staffing resource and skill mixes within general practice. Recommendation 3, the findings of Health Watch County Durham's review of care navigation and the need for a robust communication and engagement strategy to promote care navigation across all GP practices in the County of Durham. Recommendation 4, the promotion of alternative methods of accessing primary care appointments to face-to-face by utilising new technology which will facilitate online service provision. And indeed, Chairman, we can all see how that has been implemented due, unfortunately, to COVID. Recommendation 5, the use of local intelligence by the Care Quality Commission as part of its revised inspection regime. Recommending 6, the use of Section 106 agreements in planning to contribute to an enhanced health services where increased demand is demonstrated. Recommendation 7, the need for an integrated transport solution which supports people to access GP services and associated marketing and communication information. Recommendation 8, the continuation of and support for the workforce development initiatives identified and introduced by County Durham CCGs to address GP recruitment and retention, as well as the practice vulnerability toolkit developed by the County of Durham. Recommendation 9, NHS 111 and Durham CCG publicise the service's role in arranging direct appointments with GPs where appropriate, and the promotion of the facility across the community of Durham. The full report, Chairman, can be found at Appendix 2, and the recommendations for the Health and Wellbeing Board are there also. We would ask you to endorse the recommendations contained within the review report and agree to work in partnership to deliver the identified improvements. Finally, I and Stephen would like to thank members, officers and partners for their valuable contribution to the review process, and I particularly would like to thank Stephen Gwillan for his excellent support and advice, not only then but continuous. Chairman, this is also the opportunity that we have to address the Health and Wellbeing Board. May I, on behalf of my committee and members, thank you personally for the continued support, advice that you have given to the committee. You have attended every committee meeting we have and continue to support us. And Chairman, we fully support and thank you for your commitment. Thank you very much, Chairman.
Thank you, John. Very much value the work that's been done, and certainly the scrutiny's role is to make a difference, and I believe that's what is demonstrated this morning. I have got some questions, John. I think it was Faisal indicated and Joy Allen. If I take Joy first.
Thanks, Lucy, and absolutely an excellent piece of work from the committee, and obviously with some really sound recommendations. So I'd like to sort of thank the committee for all the work that they do for us. How can we ensure we have a consistent service across the county, which should in turn improve patient experience?
Thank you, Councillor Allen. Well, initially, that is for the Health and Wellbeing Board to determine as part of the levelling up agenda for healthcare across the County of Durham. The move to a single CCG for Durham will help, but less clear is the potential impact on the ongoing consultation on the integrated care system, and indeed their future role in commissioning arrangements currently undertaken by the CCG. In respect of the latter issue, it is essential that any resources required are earmarked for the County of Durham based upon its health need, and deprivation levels are retained within primary care in Durham. The report references the need for a consistent approach to communication and message management in respect of how the community access primary care. These need to be consistent across County Durham, as does any training and development of primary care staff. An example is the care navigation process introduced across primary care. Assessment now and in the future must be paramount, Councillor Allen, and must be linked to evidence-based practice, seeking out centres of excellence within the county, the region, and indeed the United Kingdom. We must test out, evaluate both the current provision and service, and ascertain what benefits are and must be achieved for our communities by adapting these models of care for our changing environment. I would say, Councillor Allen, that the circle of health should be monitor, evaluate, adapt, review, and I believe that is what we should be looking for, not only in general practice, but across the health economy.
Thank you, John.
Thanks, John.
Faisal, did you have a question?
It's a comment, Chair. Thank you very much, and thank you to Councillor Robinson and Stephen Gwillan for providing an extremely comprehensive report looking at sustainability of primary care services. To assure the Health and Wellbeing Board, Chair, the Clinical Commissioning Group have received the reports. We've considered the recommendations, and I have to say the recommendations are extremely visionary. They were pre-COVID and extremely visionary in terms of what needs to be done. And I assured Councillor Robinson when he came to the CCG's Primary Care Commissioner Committee that we will undertake a review of the recommendations and report back in 6 months' time. Extremely welcome, Chair, and Councillor Robinson's aware of that, so too is Stephen Gwilym, and we want to make sure we continue this collaboration with the Overview and Scrutiny Committee to inform and support the way that we do business for our communities in County Durham. In short, Chair, welcome the report wholeheartedly.
Thank you, Faisal. Do I have any other questions from members?
From Councillor Finlay, Chair. Sorry, from Stuart Finlay, sorry.
I'm not sure whether that's a promotion or not, Andrea.
Stuart.
Yeah, so again, I would just like to say thank you, to the committee for this report. It's really encouraging to see this, cross-party support to help sustain primary care across Durham. And as Faisal has said, we're in the process of refreshing our primary care strategy, and the recommendations that you've made will certainly feed into that strategy. As you know, we've also seen considerable changes as a result of COVID. It's in some ways catapulted technology a few decades on, and I think primary care was already well advanced in its use of technology. The use of remote consultations, both in primary care and secondary care, will dramatically change the face of primary care, I think, forever more. We need to realise now that a lot of work that was done in secondary care on a face-to-face basis is now being done in primary care, and primary care are having to take on a lot more work than they did before to help our colleagues in secondary care, and to make sure that patients don't travel to a hospital setting unnecessarily. Now that will have an impact on the estate that we have in primary care, and in some ways we may not need the amount of estate that we had in the past, as a lot of work moves to remote consultations. I think it was an interesting comment about a fair and equitable service across the county. And if you look at the primary care contracts, and if you look at some of the investment that we make in primary care in Durham, there is an element of choice, and some practices may take up that choice and some may not. And so there is a danger that we have a postcode lottery across the county. So as you say, bringing the two CCGs together means that we can have a single way of doing this. And we have a local improvement scheme in which we invest a considerable amount of money in primary care. And it has always been slightly different across DDES and North Durham. But we are using this year as an opportunity to make that the same local improvement scheme across the whole of County Durham. And we're also looking to see if we can use that local improvement scheme to put in place a block contract so that every practice, either on its own or through working with its primary care network or its federation, provides the same access to services across the whole of County Durham. So people will not be faced with a service that they can get in one practice but not in another. And we think that by using primary care networks, practices should be able to offer an enhanced service. So even small single-handed practices using the primary care network should be able to offer that enhanced service for their patients. And then just finally, as we move to a new way of working in the NHS, and working more as an integrated care system across the North East and North Cumbria, I think it is really, really important that Durham lobbies to have control over its own budget in Durham, and that we preserve the investment that we make in primary care and community services in Durham, which I think is probably more than any other part of the North East and North Cumbria, if not more than any other part of the country. And we need to work hard together to make sure that we preserve that investment. Thank you.
Can I come back on that, Councillor Huddles?
Yes, John.
Can I say that, Stuart, you have supported us strongly as a committee and have attended and answered openly all the questions we've given. You can see the integrated care system, the value of it, when you look at Carlisle and Cumbria and the problems they're having with COVID and the fact that they've been able to move people into Newcastle hospitals. So there are values like in that area. But you know, Stuart, that we have seen and watched and we've evaluated the work of your CCG and North Durham. You've consistently retained the funding within the County of Durham, and we've always thanked you for that. We've always had concern as these new systems come in that the money would be taken out of the county and would prop up James Cook Hospital in the south and integrated would prop up the Newcastle hospitals. You have consistently worked with us and assured us that that money would retain within the county, and that's why we fully support our CCG and why we fully support the primary care network you're bringing in. We will, I assure you, over the coming months and years, fight for the retention of the funding within Durham, and will cite you and your CCG as a centre of excellence for doing that. So it is a fight that we will take on board, Stuart, but we will be able to quote you and the work you have done as a success. Thank you.
Thanks, John. I've got Jonathan, I think, got a question.
It was another comment, actually, Chair. It was a hat trick of thanks from the CCG. My two colleagues have said so much. There's really very little for me to say, but a very wide range report, very, very welcome. And I like very much that it highlights areas of excellence as well as areas of challenge. There's some things that we're very, very proud of that we've all worked on together, such as the Career Start scheme, primary care networks, and really everything's been said. I share the concerns about the ICS and the funding. I agree with Stuart. I think we fund practices, primary care at a higher level than anywhere else, and we see the benefit if that funding is reduced. So I'm sure our partnership working can continue to try and protect what's important to us. But thank you very much.
Thank you, Jonathan. We have the recommendations there. Can we agree them? And with that, I'll move on to item 11, which is the physical activity strategy, and welcome Maxine Rhodes, who's the Managing Director of County Durham Sport.
Thank you, Chair. I'm very grateful to have a chance to speak to you all. Thank you very much. I'd like to just report on the Physical Activity Strategy Committee, which has been set up in the last 12 months and has made substantial progress. So the Physical Activity Strategy Committee is responsible for encouraging partners to work together and promote change that ensures an active lifestyle is an easy choice for all residents of County Durham. And I don't really want to run through the report, but merely to say a few things, if I may, about the successes we've had in the last 10 months or so. Firstly, can I thank Andrea Petty and Kate Cattell for supporting getting this committee off the ground. It's been an enormous privilege to work with both of them. And I know that before I arrived in post, there was a lot of work already being done by Andrea and Kate to make sure that the committee was a success. So I'd like to thank them both for that. And if I may just briefly draw the board's attention to the work of the committee in shaping policy, developing the physical activity framework for Durham County Council, and through the evidence-based group, designing a knowledge hub for knowledge exchange, where our partnership with the university is incredibly important. So I think that this new committee gives us opportunities for greater effective partnership working for the benefit of residents in County Durham. Thank you.
Thank you, Maxine. We do have a question for you. Joy, Councillor Allen.
Thank you, Chair. The case study in the Joint Health and Wellbeing Strategy refers to active Shildon and active valleys. Are there any plans to roll this out to other areas within the county?
Thank you. Well, the aim of the Active Places pilot is to increase and sustain physical activity levels in the targeted areas of Shildon and the valleys. and we do intend to take a place-based approach as County Durham Sport to tackling inequalities. So in collaboration with Durham County Council and others, we work to look at bringing further funding into the county, and this place-based approach has been the central method of our application for a 5-year funded programme in County Durham based on improving physical activity through football. So the areas being targeted for this will be the north and the east of Durham, and of course learning from the Active Places pilot is being used as evidence to strengthen our application to the Football Foundation. And it's really pleasing to see how the collaboration of the partnership has worked here to highlight the success we've had and how this can be rolled out to other areas. And I think this is going to be increasingly important as we move forward over the next 10 years, as we see from Sport England that place-based work is becoming much more important to them. And I think it will likely form part of their new strategic plan, which is due for publication on the 26th of January. So people might be interested in joining a launch event on that date.
Thanks, Maxine. I've got a question, Maxine. What impact has COVID-19 had on the physical activity, and how can we work around this relating to technology, both for adults and for children?
Yes, thank you, Chair. This is a very pertinent question. We're just beginning to draw together the wealth of research that we've completed within the county and across the region, and to look at this in line with national data. And the first thing to say is that something that won't surprise you, Chair, is that inequalities have widened, and this is the case with physical activity. So the first lockdown saw huge decreases in adults' physical activity levels and subsequent consequences for mental well-being. And the impact of that was felt particularly badly by those from lower socioeconomic groups and those with long-term health conditions and disabilities. So I think what we're seeing is that for the recovery is that promoting accessible, low-cost exercise options is essential as we move forward. And with regard to children, what we've seen obviously is a reduction in physical activity levels during the pandemic. And unfortunately, the existing socioeconomic inequalities in physical activity levels have been hardened. But we can learn that outdoor activity and active transport, I think, are probably key areas to be highlighted in our return to sport and physical activity. And another thing that's been quite interesting coming out of the research is the increased need for choice of type of physical activity, and this will especially support girls to be more active. So some people, it seems, were able to adapt and find new and even more ways to be physically active during this current pandemic. However, for others, physical activity levels were much reduced. And this impact is experienced disproportionately by the most disadvantaged in our county and those with long-term health conditions and disabilities. So to move forward, we need to promote and facilitate popular forms of free outdoor exercise. And with regards to the digital platforms, I think we've seen from the research that both adults and children maintain their physical activity engagement. By using online platforms, they become more popular. But the issue that we're most concerned with is that there's a sizable proportion of the community who are not digitally engaged. And so we've got to be very mindful as we move forward that we need to accommodate those without access, skills or confidence to use digital methods. So what we found is that digital platforms aren't a silver bullet, and that in the Northeast, 9% of the population are not online. And from research with other active partnerships, what we've seen is that those with lower levels of digital confidence then have lower levels of physical activity. So it is a real issue, Chair, that you're raising. And I think the research that we've done to date makes a number of recommendations around supporting digital skills and confidence, providing technology where possible, improving access to our understanding around affordability and improved access generally. And I think critically, continuing to provide offline engagement for people and alternative platforms to those that are currently found online. And critically, again, in the bounce back, promoting and facilitating free outdoor exercise options like walking, running and outdoor gyms are going to be absolutely critical to encouraging the population to become more physically active and even to return to physical activity. Thank you, Chair.
Thank you, Maxine. I've got another couple of questions from members, Maxine. Councillor Gunn first, and then I'll take Faisal. Councillor Gunn.
Thank you, Chair. And thank you for that, Maxine. Councillor Allen mentioned active children and active valleys, and both Councillor Allen and myself, I represent Whittington Hunwick division. We're both quite close to children, and I think we have seen, can't speak for Councillor Allen, but I'm sure she has, that the success of active children in respect of its use, and particularly with families during the current lockdown we have, and previous ones, and also around the whole COVID situation, if you like, because there are so many of our families with people who have been furloughed or who are unemployed now, and we're seeing that rise. So for us, I think the key thing is locality-based exercise. And I know that you mentioned the free outdoor activities. It's absolutely crucial to have free outdoor activities during any time, but particularly at this time. And I think, you know, supporting walking and all of those things, we live in areas where we can actually get outside onto bridle paths into the countryside, and we can use all of that. But I'm very interested to see locality-based things like active children. I've not been there on the site, but I've seen videos of it. I've seen it on Facebook being used, and I think that for me is something that many of our families would want to engage with, and can only be absolutely brilliant in terms of their health and well-being. Thank you.
Thank you, Alvin. My mistake, Faisal, I thought you had your hand up, but I'm sure the question's been asked. Can I thank Maxine for coming and presenting today, and I'll move straight to the recommendation. Can we agree the recommendation and note the contents of the report?
Chair, Dr. Jonathan Smith was going to come in.
Oh, right, sorry. Jonathan?
I am sorry, I was late to put my hand up. That was my fault. I just want to say it was a very interesting report, and I too have struggled with some of these issues. You know, why do we have such wonderful outdoor spaces, yet the deprived areas don't seem to access them as readily? You know, where my practice is in Easington, you know, we've got such lovely trails that you can walk on to rival anywhere else in the county with the views and so on. Yet they stand largely empty. You know, I occasionally go for a run and I don't see anybody else out running. But, you know, if you go to the centre of Durham, you know, you can't move for joggers. You know, it's really interesting, and I think a piece of work to understand the psychology behind it and how can address that. It'd be so useful. Yeah, it's very interesting. But sorry for the late question.
No, very important, you know, it's top of my agenda, Jonathan, because I know we've got the old pit heaps and our communities haven't really changed that much, but to open where all that planting took place is a real community asset, and it's free, it's on people's doorstep, so it's very much high on my agenda. I've opened one particular area up. It's my intention to open others across my division, and I'm sure the other members will be doing the same. and I'm sure some of that work will come out in terms of the town and regeneration work that will be taking place across the county. So I thank you for that. Very, very important. Moves us on to item 12, property update. Andy Palmer was with us this morning. Can I welcome Andy? And Emma Gardner from the Policy and Executive Support Manager. And can I just mention at this moment in time, we've got Angela who attends our meetings as a guest to our meetings, and she's with us this morning as well. So over to you, Andy.
Thank you, Chair, and thank you to members of the board for inviting me along this morning. I'll just introduce myself for those of you who don't know me. A number of faces on the screen are familiar, but there's some unfamiliar faces too. So my name's Andy Palmer. I'm Head of Transformation in the County Council, but I also take a strategic lead in coordinating the anti-poverty work that the County Council undertakes. And it's with that hat on that I'm presenting to you this morning. And the report that you've got in front of you is largely an information report, and that is reflected in the recommendation. And it just shows the breadth of work that has been going on for a number of years, both within the County Council, but much more importantly, I think, within communities supported by the council and by other public bodies. And it is really that community work which has made the enormous difference to our anti-poverty work in communities. The report covers, as I said, some historic work that the council has done. The council has been coordinating its anti-poverty work with greater focus really for the last 5 or 6 years in response to the welfare reform agenda of the government, but more latterly because of the COVID-19 pandemic, that has caused us to refresh and refocus some of our efforts on the poverty side of things. So I'll run through the report with you. It's a very long report. You'll be pleased to know I won't read it out to you. We would be here for quite some time, but there is a lot of information in it, and I would I'd urge members of the board to kind of absorb it at their leisure, really. So the first thing I'd like to say is that the links and the interrelationships between poverty and health and well-being are obvious, well documented and well evidenced, and some of that evidence is contained within that in the report that you've got in front of you. It's a small paragraph in this report, but paragraph 2 in the purpose of the report is actually one of the most important, because it simply says that the external policy environment that the government have set us is changing incredibly quickly. Almost daily there are new policy announcements or changes to policy, which are of course well documented on the news. And the reason that is so important to the work that we are doing is that we try to add value to national programmes and to national initiatives. We don't try and duplicate things or do the same thing in a slightly different way. Our role is to work in localities and with communities to make sure that people can either take maximum advantage of government programmes, or indeed we'll fill the gaps where there are gaps. So just running through the executive summary for the board. As I said, the council has a long-standing record, as do other public bodies in tackling anti-poverty work. But over recent years, as I said, that's been around welfare reform, and in particular the fairly sizable cuts to particular in-work and out-of-work benefits, and we've been supporting people through that. We do that through a poverty action plan, and that is contained within this report. You'll see as an appendix we have the poverty action action plan, and we refreshed that, as I said, for COVID-19. And we brought to the fore the themes around employability, advice and guidance, welfare and community resilience are the main themes that we have been working with. We have a fourth theme, which is around children and families, and Amanda mentioned that in the strategy report earlier, the work that goes on with children and families. We do hear a lot about child poverty, and I do think it's very important to make the point that children are part of families and a wider network, and so it's really important that we tackle not just child poverty but family poverty and poverty more generally across the county, and we have a number of initiatives which help us do that. So if you have a look at paragraph 7, that just runs through a very quick summary of some of those things that we've done through the poverty action plan. Paragraph 8 just documents the work that we do on employability. Employability is the work that we do with our partners across training agencies, colleges, job centre, etc., and a partnership approach to help people into work. And I'm sure, again, the links between unemployment and health and wellbeing are well documented. The council, we've primarily been using funding through the European Social Fund to boost our work on employability. Through the Poverty Action Steering Group, we have supplemented that work because obviously with external grant comes external grant conditions, and we've supplemented that so that we can support particularly young people through our new employment centres, working with Job Centre Plus, and also through our employability team to be able to work just with whoever needs support, really. Paragraph 10 just runs through some of the extensive government measures that are in place. They are very welcome government measures, particularly where there are excuse me, where there are measures such as the temporary cessation in benefit conditionality, suspension of evictions for rent arrears, etc. These are very welcome measures in the poverty world, as well as some of the new employability measures. However, at the start of the pandemic, well, actually just prior to the pandemic, after the Poverty Action Plan was agreed by the Council's Cabinet in September 2019, the County Council did agree to an additional investment of £1.5 million into anti-poverty work. And that has really driven a lot of the work that we've done through the COVID-19 pandemic. That has been supplemented through additional resource that we got in from DEFRA, and more recently a winter grant to support families during the Christmas and February half-term holidays. And again, the work that we've done on that is documented in the report, which with the voucher schemes that the council has initiated to support families on free school meals during the holiday period, but also to support those families with utilities as well, and we'll continue that work. Not documented in the report because it was a more recent announcement. We've also been allocated a maximum amount of £2.2 million to support us with holiday activities with food from Easter onwards for a period of 1 year. So that's very welcome. And as was mentioned earlier, we have a working group working specifically on children and families, which is looking at those issues. I'm not going to, as I say, kind of read out the whole main body of the report, but paragraph 23 onwards gives you a lot of the evidence base that we're working on around the poverty agenda. And what it really highlights to us is that there are a lot of vulnerable families in the country. There are a lot of vulnerable families in County Durham. And I think it's fairly obvious to say that the economic situation during the pandemic has only exacerbated the issues that many families are already facing. But we're also seeing people coming into the world of unemployment or low income who've never been in that situation before. And so we're finding our advice and guidance services are having to pick up new clients who've, as I said, have never been in this situation before. And that is very, very difficult for them. If you have a look at kind of paragraph 37 that talks about the national policy update on welfare, but really what I want to focus on is paragraph 39 onwards, and that is the council's response to the pandemic, which we've done through the Poverty Action Steering Group. So you'll note there that there are a number of initiatives which we have undertaken. So we have reviewed our advice and guidance policies. We have boosted support for children and families through the holidays. We have put significant resource through our area action partnerships into communities, and it is that local community response, particularly around some of the areas that I specifically lead on, which is emergency food and welfare provision. And the community response during the pandemic has been absolutely fantastic. And we are wishing to build on that to support people as community champions as we go forward through our County Durham Together initiative, which I'm sure members of the board are aware of. Paragraph 48 just shows the 4 objectives which we have, taking this work forward. Excuse me. And further on in the report, paragraph 55 onwards documents in much more detail the exact initiatives that we've taken over the last 6 or 7 months as we go through the pandemic, through our AAPs, but also through our direct service provision. So that's everything from our community resilience through our area action partnerships, volunteering, employability programs to support people back into work, welfare and money matters to help people try and manage money, but also to help people in financial hardship. And as I said earlier, the work on children and families, which Amanda mentioned earlier, some of the cutting the cost of the school day, but we've supplemented that with a back to school support fund. We are supporting families to access welfare benefits. We support families through the council's own welfare benefits, our daily living expenses, etc. And the council has always funded holiday activities with food, and that has now been supplemented by government resource, which is of course welcome. But the fact that we have the infrastructure in place makes it a much more slick task for us in County Durham to administer that. Paragraph 61 just shows some of the investments that we've put in over the past year. The most recent being the winter fund, which we've put in place to support families over the holidays. And one initiative I would like to mention, because it's part of our ambition, is not to be relying on government grant, not to be relying on council expenditure, but to try and make a real and sustainable difference in our communities. And so we've invested in a community-based initiative called the Bread and Butter Thing, which uses surplus food from national suppliers and distributes that in communities, by communities and by community groups. And we've launched that in the county. We're hoping to, over the next year, our ambition is to develop that into a further 10 areas in the county. And I was just talking to Councillor Surtees the other day, who chairs the Poverty Action Group, who was telling me that the families in Eden Hill, 500 families have already benefited to the tune of £11,000 off their food bill, which is an astonishing achievement on what you can do. There's lots of information in the report. I'm sure I haven't covered all of it, but rather than keep you here all morning, I'll open it for questions. So back to you, Chair.
Thank you, Andy. I did see the bread and butter thing on the television on the Peter Lee estate last night on the news, so well done whoever was behind that. Certainly had an impact, and I was quite pleased to see that moving on. And obviously our thanks to Angela, who's with us today, and yourself and the team for doing this work. I'll open it straight up to Councillor Gunn.
Thank you, Chair, and thank you to Andy and to Emma and to Councillor Surtees for that very, very comprehensive report. Obviously, as the portfolio holder for Children and Young People Services, I work very closely on the issues affecting children and young people in particular. I want to ask a question of the board, Chair. We can see here in this report that Andy has outlined very comprehensively, and I think it's an excellent report, but we can see that there are many, many layers to poverty. It's a huge area, and I don't have to tell people really, but we know that child poverty over the last 4 years has increased dramatically in the Northeast, from somewhere like 26%, I think it is, to 35%. That's a massive, massive leap, and it's shocking. It's a shocking level. Well, it should shock everybody, and it's likely to rise further due to the economic impact of COVID. And it's wonderful to hear about the bread and butter thing and how that is working, and it's great to hear that all of our voluntary groups and communities are providing help and support. But it shouldn't have to be like that. It shouldn't have to be that people are relying on those sort of things to actually keep them fed, and there's fuel poverty as well. And I'm just really concerned about that and the longer term impacts of COVID on County Durham families. And Andy pointed out, and he's absolutely right, it's something that's irritated me for a long time, that children are not in poverty. We use those terms, but it's not children who are in poverty, it's families who are in poverty. And so I'm really concerned about our County Durham families, and some of them, many of them now, are finding themselves in poverty for the first time. The first time that they've been unemployed. So for me, what we absolutely urgently need is a comprehensive government plan to tackle poverty, in the whole of the country. But in the Northeast, it is really, really a crucial, awful situation, and it's going to get worse. So what can we do as a board, Chair, to actually push for a government plan to tackle poverty? I'm sure that many of our representatives here on the board would want to do this, and what can we do? Thank you.
Thank you, Olwen. I've got Angela who's wishing to speak. Angela, do you want to make a comment?
If that's okay, Chair, I would just like to address the board. I mean, I appreciate that, you know, I'm here as an observer. I can't add anything to the report that Andy's given. He's given a very comprehensive report. But in terms of the poverty work that we are doing, a lot of the stuff that worries me going forward is around the uncertainty in families. And what that uncertainty does is that has a knock-on effect with people's financial hardship, but also into their mental health and their well-being. And for me, I think one of the things that's very important to note here is a lot of this investment that Durham County Council has given into the Poverty Action Steering Group, and a lot of the work that's gone forward here has all been done with just some injections of cash, and they're 1-year injections. So we won't have that injection of cash next year. and you mentioned the European Social Fund that supported unemployment. After 2023, because we're not in the European Union anymore, there's no more European funding, so we're having to depend on the shared prosperity, which is very uncertain. So for me, I think that poverty is something that has affected everybody, not just people on benefits, not just people who see it on an everyday basis in the advice and guidance work and the job centres. It's been seen by every single professional across the communities, the health sector, the community sector, and dare I say it, even the government, because they've made so many U-turns about some of the policies going forward. For me, I just think that we do need to continue to raise awareness of poverties, because they are complex and they are multiple. And I heard somebody talk earlier about digital inclusion. That's also in our plan, because we have found that that is an increase in poverty going forward too. And we also sometimes forget about in-work poverty people. We have people that go out to work on a daily basis and they are asset rich but cash poor. So some of those families are relying on food supplies and support with benefits and things. So I think just going forward with this, I would really, ask that if the Health and Wellbeing Board can support in any way forward, that would be absolutely amazing. And the only other thing that I would like to say, if anybody would like to talk about poverty and the work that we are doing, just drop me an email. The door's open. I'm happy to have a conversation, and if you want to see how you can feed into the poverty work, please get in touch. Thank you, Chair, much appreciated.
Thank you, Angela. Councillor Gunn.
No, I think sorry, Chair. I think that was a legacy hand. I think
okay.
I actually my question.
That's good.
Is very much.
I think what we've
can we support?
Yeah, say that we've sent letters off to the government around all kinds of issues, and I think we should continue to do that, because that poverty does impact on health, and we, the Health and Wellbeing Board, and if we can make a difference, that's our job. I think that's what we're here for. That's what we have to do. It may be that we look at a joint letter and supported by our partners to go off to government in relation to supporting and lobbying for this additional funding that's needed to continue the work. I'll leave it there and ask Jonathan, do you want to come in? Jonathan Smith.
Thank you, Chair. Yes, I echo the comments. Fantastic work that the council has been doing. I just wanted to bring something up that we've seen at a presentation here from our public health colleagues in the last year or so, and it was about the impact of smoking on poverty. I can't remember the exact figures, but I think we have several thousand families in County Durham living beneath the poverty line because of smoking. And I'm sure with COVID-19, our smoking cessation rates are down. I'm sure that will play a big part in the future of improving the poverty problem that we will face. But I'm sure our public health colleagues have already got that well in hand.
Thank you. Valued contribution. I've got Amanda with a hand up. Amanda.
Thanks, Chair. And I think it's a really valid point, Jonathan. And Jane Sunter, who's our lead around tobacco, is part of the Poverty Action Steering Group, and I think she's there for, I suppose, definitely picking up on the tobacco and how we support lifting local families out of poverty through supporting them to stop smoking, and that's particularly looking at the illicit tobacco as well, and work with our kind of community protection colleagues and reducing illicit sales of tobacco. But also Jane's there because of another piece of work that has been presented here has been the health impact assessment around COVID, and obviously poverty was one of the key factors that looks like it could be widened due to COVID. So there are some specific recommendations in there that Jane will link to Andy and to Councillor Surtees to ensure that they are taken forward. So you're absolutely right, we need to make those very, very clear links with the health and wellbeing agenda and into the poverty agenda. So we'll continue to make those happen.
Thanks, Amanda. So with that, can we agree the recommendations outlined in the report, and can we agree that as chair and with the help of Andrea, we'll pull something together and send it off to government, obviously with the contributions that people made this morning. With that, if that's agreed, we'll move on to item 13, is the Child Death Overview Panel. Amanda, this is another report for you, an annual report.
Yes, thank you, Chair. And I just wanted to bring the board's attention to the Child Death Overview Panel annual report today. And first of all, I do need to say thank you, a bit similar to Maxine's thank you to Andrea and the team who've done a huge amount of work in relation to the child death panel and supporting the lead clinicians in terms of the reviews that take place in relation to the child death overview work. And this, you will see the detail in the report. This report's for 2019 to 20. And I'll come back to the recommendations in the report. It's obviously, to present assurance to the report, to the work that takes place. And while the accountability for child death overview goes to safeguarding, the importance for this board is to really identify where there are any modifiable risk factors and to ensure that we're taking those modifiable risk factors forward into the plans and actions for the Health and Wellbeing Board. So Child Death Overview has a responsibility to ensure that every death of a child under the age of 18 is reviewed, and also to look at any kind of common themes to do in relation to those deaths, and to then make recommendations to any and all relevant organisations, and to notify the Child Safeguarding Practice Review Panel and Safeguarding Partners if there are any suspicions that a child may have been abused or neglected, or the medical examiner in terms of any issues in terms of the certified cause of death. You'll see from the membership, and again during COVID, the CDOP, while I think it's had a couple of meetings cancelled, it has continued to meet. And I know this report really covers the time period slightly, up to the beginning of COVID. We have a very broad and very experienced membership of the Child Death Overview Panel in County Durham, particularly in terms of our designated doctor, Nina Cook from the Foundation Trust, Children's Social Care Police, designated doctor, and certainly the meetings that I've chaired, because prior to myself, Jill O'Neill chaired, and prior to that, Mike Lavender chaired. There are we've got some real strengths and expertise in County Durham, as well as real commitment to ensure that those deaths are reviewed fully and any themes and any actions are taken forward. So the report itself looks at 1st of April 2019 to 31st of March of next year. And fortunately, although numbers had increased slightly, our numbers of child deaths under 18 are still relatively low, and it was at 28 deaths and 4 deaths in Darlington, and we are a shared overview panel, and I'll come back to that. And there were 20 of those reviewed, carried out by the board, and they found that there were kind of modifiable factors in kind of 5 deaths, and some key factors identified, and they're identified in paragraph 9, which included things such as co-sleeping, awareness of sepsis, for example, neglect. So it's really important, once again, that as a board we take any of those actions that we have responsibility for forward. And I think it's got to be recognised that obviously many of the deaths do relate to perinatal or neonatal deaths, and some of those are expected, and some of those obviously are not. And there has been a particular issue in terms of slightly higher percentage of male deaths. There are a few areas that we really need to consider as we progress the work, and that's taken over the course of the last year. Signs and symptoms of acute illness in children, accidental deaths, and that was one particularly in relation to bike safety and neonatal deaths. And this is one that has been on our radar, the neonatal deaths, for some time now. We did write to the neonatal network and we are continuing to follow up in relation to that work. However, the Child Death Overview Panel is also about drawing out areas of good practice, and certainly Chair and colleagues, from having worked in another local authority, of the role of the rapid response team, and having a rapid response team is a huge benefit in County Durham, and to see that the support that is wrapped around families when their child dies is a really exemplar piece of practice. And another piece of really good practice has been our 0 to 25 service being trained in bereavement support for children that have been affected by the death of a child, so that kind of wider influence on children. You'll see some of the developments in there over the course of 1920, and some key implications for the board in terms of that good practice and the assurance that we are complying with the working together guidance. We are, as a board, working with colleagues in TEES to look at the potential coming together of the Child Death Overview panels, but particularly with an emphasis on thematic reviews. In reality, there should be around about 60 deaths per year to enable us to really look at any themes that come forward, and obviously we're at 28 deaths, so the combination of other panels would enable us, for example, to look in more depth, more in depth at some of those key themes. However, Chair, in terms of recommendations, it's really to note the contents of the report, to recognise the work that is taking place to raise awareness in terms of some of those campaigns around bike safety, and also some of the other modifiable factors for co-sleeping. For example, we're doing work with our foundation trust to develop work on co-sleeping, and to note the ongoing work in relation to the drawing together of panels and thematic reviews. So I'll stop there, Chair, and obviously the detail is held in the report.
Thanks, Amanda. Again, a lot of good work taking place. We've got the recommendations there. Can we agree the recommendations, members? And can I go straight on to questions? Councillor Joy Allen has a question.
Thanks, Chair. Thank you, Amanda, for that really important update. I can't think of anything more important than looking at prevention of child deaths. In terms of raising awareness, what can the health and wellbeing partners do to support the very important work around prevention?
Thanks, Councillor Allen. I think it's a really important question. I think that's why bringing this report and some of those key areas of work, and if I draw out one area of work that we're really focusing on at present, is around co-sleeping. So as we develop that work, I think what would be really important for the board to do would be, with our partners and with obviously the range of partners around the table, would be to support the campaign and the engagement with parents that we will have as a result of that co-sleeping campaign. And then I think the other one is as where there are modifiable factors where we feel that either the children or the family have been let down and we may need changes to services. I think that's where the board could advocate on behalf of the Child Death Overview panel for some of those modifiable factors to be prevented. Hope that helps.
It certainly does.
Thanks, Amanda. I've got a question, Amanda. When we received the last report, we advocated for system change across the North East area. Are you aware of any improvements across the region since our letter was sent to the ICS lead?
I think, Lucy, what I've set up is I've set some time up with the medical director of NHS England to go through the detail in that letter. We have had some assurances, but I think it would be really helpful if I kind of met face to face with Chris Gray, who's the medical director, and go back over the detail in that letter in terms of particularly those neonatal deaths, because we had raised those concerns, and we've had some of that assurance, but it is now over a year, and some of those neonatal deaths are continuing. So, and then I'll be able to bring a more detailed update back to the board once I've met with Dr. Gray, if that feels okay, Chair.
That's great, thank you, Amanda. Certainly gives us a lot of reassurance. I'll move straight on to item 14, which is the campaigns. Amanda, and this is down to you as well.
Thanks, Chair. I'll just thank you, Nicole. And as ever, I think as the Health and Wellbeing Board, we have some real key campaigns, and I'm just going to draw out a couple of things from our winter campaigns that are ongoing. Thanks, Nicole. We've done some really again, some really in-depth work in terms of our COVID-19, with the 7 local authorities commissioned some insight work with members of the public, our local residents, and on the back of that came the Beat North East COVID campaign, and you can see the picture there is Brenda, who's a grandmother, I think, from Sunderland, and I think we had one of our local bus drivers was fronting the campaign, and it was a thank you for people to continue to support the regulations, but really understanding what people were finding difficult, and it was the social distancing that people were finding particularly difficult, and I think given where we're at with COVID, that is something that's going to be really important to kind of continue with. We've done obviously some work on the vaccine, and I think obviously the communication in relation to the vaccine will become increasingly more important. I think there's been a lot of national information, but I think we've started to give those key messages in relation to the guidance hasn't changed, and even if people start to have the vaccination, they need to continue with the existing measures that are in place. So I think the vaccine will very much come to the fore. Thanks, Nicole. Mental health, we've talked about mental health, and this remains one of our board priorities. And we heard about the healthy businesses at the last board, and we'll continue to carry out a campaign which focuses on the pressure brought on particularly during the winter, and working on workplace mental health and working age adults, particularly an interesting link back to obviously what Andy was reporting in terms of financial insecurity, particularly those who may have lost work during the pandemic or the end of furlough. So very much a focus on our working age population, linked to that kind of living well, and linked into the poverty agenda. So some very there'll be targeted advertising on social media, TV and digital, because that's still, certainly TV is still one of the best way to reach some of our people. We've heard again about not everyone is able to access things digitally, so we'll be using all of those different means to reach people in terms of mental health. And then, thanks, Nicole, the NHS have obviously had their annual campaign in relation to ease pressures, and the latest messaging focusing on the 111 services in terms of accessing A&E, and to direct people to use 111 rather than going straight to A&E. So that's been one of the regular campaigns. And then to round off, in terms of alcohol, for dry January, thanks, Nicole. And as ever, I think County Durham seen one of the biggest sign-ups across the country, and some real key messages in terms of getting the U back. We know that people have drunk more during restrictions, so this is a way about shaping in terms of getting the U back and having alcohol-free days and the benefits of that, and trying to do that in a positive way. And then I think just in terms of alcohol, just to let board members know that Colin Shevels, who's our Director of Balance, has announced that he's going to be taking early retirement at the end of March. So I'm sure board members, Colin has been to the board and has obviously been a really strong advocate for us across the North East and County Durham in terms of the alcohol agenda, and I'm sure he'll be missed when he retires, but I'll keep board members up to date in terms of his successor. So thank you, Chair.
Thanks, Amanda. Joy, you have a question, Councillor Allen? You've got your mic off, Joy.
Thanks, Amanda, and for the update. Particularly disappointed to hear about Colin, because I think he's done such a tremendous amount of work across the region, and I hope that we've got somebody that's going to sort of work with Colin before he retires, because the knowledge that he has is very, very valuable, and I think data, as we know, sort of drives performance and also helps us challenge those that we need to challenge. Just a quick one on the, obviously I'm a big advocate and a great amount of effort from your staff as well, and also we've done within the county for signing up to alcohol free and dry January. And I've noticed the good thing is that some of the big brands are advertising alcohol-free products on the television, on mainstream television, such as the gin. So Gordon's Gin's been there, the dry gin's been there. Absolutely fantastic amount of alcohol-free alternatives in the supermarkets. So there's no opportunity to be bored doing dry January, and the drinks you can choose are fantastic. My problem is, and we don't have this at the moment because we all locked down, but the problem that I've seen in having those choices and having healthier drinks is that they're not there on the in the bars and in the hotels around the region. We did do it through Best Bar None to identify the areas, that the bars that were giving customers a lot of choice, but normally there's might be 2 token drinks. And is there anything that we can do to encourage the bars and restaurants and hotels to stock more products and to encourage people to try the alternatives? Because to be honest, the prices doesn't seem to be any different. So I'm sure there's somebody will be making the profit along the line, but just means people are living healthier lives, particularly in lockdown when there's been concerns that people are drinking more at home. I think we could do more to promote the alternatives in the market.
Yeah, thanks. I'm sure that is something we can give Colin that task before he retires, to look at how we do think about those alternatives. Obviously, the big pushes around having alcohol-free days, but then you're having some of those alternatives, and particularly the alternatives that are cheaper. Because I think you're absolutely right. I think some of the alcohol-free alternatives that still look like alcohol are equally expensive and sometimes more expensive. So I'll talk to Colin and see what are the plans in terms of with the industry. And it's quite a balanced and tricky relationship with the industry at times, understandably, but to look at how we can promote some of those alternatives, and particularly looking at the pricing of those. So I'll talk to Colin about that and look at if there's any plans in the pipeline to really push as we come out of lockdown, and perhaps bring that update back, Joy.
Thanks, Amanda. He's going to love me for that, isn't he? So just tell him love that challenge before we got that task. Thank you.
Well, Colin's been with us since the beginning, really, hasn't he? He's been with us all down the road, and he's certainly made an impact, and he's made a difference. And as chair of the Health and Wellbeing Board, I'll be sending him a letter to wish him the very best in the future, and to recognise all the work that he's done across the area. Just in terms of dry January, what's been the take-up this year across the County Durham? And as its particular importance given to the impact of COVID, which looks like to have increased people's alcohol consumption.
Yeah, Lucy, I mean, I think as ever, I mean, and it's interesting, I think even as the council, I think last year we had people on the doors as people were coming in and asking people to sign up, and we've had to do it in a much more remote way this time. So we have had good sign up. I'll get those exact figures and get Andrea and colleagues to circulate them around, and to see how many people make it right to the end of dry January. So we've had to be more creative, I think, in terms of how we've reached out to people rather than doing some of that direct, but absolutely we've seen certainly alcohol consumption increase, and that links across to weight, mental health, etc. But we've tried to encourage people, and we've still got case studies, etc. But I will get those exact numbers, and I'll do that. I'll not ask Colin to do that. I'll get those numbers.
That's great. Thank you. Okay, we move on to item 15, Local Outbreak Engagement Board. And again, I think it's Amanda.
You see, next time I'm going to get members of the team to come and present, so because you'll all be sick of me. However, I suppose it is really important, actually, this because Jane chairs our Health Protection Assurance Board and gives, you know, real oversight of all the work of the partners in terms of the Health Protection Assurance Board. Thanks, Nicole. So just an update, I think, from last time. I mean, you can see this is again Durham Insight. That was of the 7th of January. Up until the 19th, our rate has now reduced, which is obviously good news. Our rate on the 19th of January was 311, so that is a significant reduction. However, I think obviously board members and certainly health colleagues around the table will very much understand that we'll tend to see a lag in relation to hospital admissions and possible deaths following an increase in our rates. We saw a significant increase in our rates just after Christmas. So we had 2 days in County Durham where we had 500 cases per day on the 29th and the 30th of December, and the same on the 4th of January. However, we've started to see that reduction now, which is obviously really positive. We have also seen, and obviously you can see the England rate there is slightly less than that now at about 500, but it was at 619. And I think we saw the new variant strain appear first in London and the southeast. But from Health Protection colleagues at Public Health England, it's anticipated that we have around about 70% of our cases are probably the new strain of the variant, which is much more transmissible. So all of the existing measures that we have and messages that we have in place need to be kind of doubled down on, really. But obviously this does give a comparison across the northeast as well. Thank you, Nicole. So since our last board, it hasn't been quiet. I think what we saw, we were in, I think, tier 3 then. We moved into tier 4 in between Christmas and New Year, and then obviously into the national lockdown on the 6th of January in response to steep rise, and really back to some of those messages that we had earlier in the pandemic about staying home, protecting the NHS and saving lives. And there's been a huge amount of work that has taken place to support this, to ensure that people who can work at home do work at home, and to obviously work and look at our work with our schools where they are still open for the vulnerable children and children of critical workers as well. So a lot of change, and I think some of that change can obviously be confusing for our communities too. Thanks, Nicole. Some of the work that the board has been doing in the last couple of months, we've already mentioned the Beat COVID North East campaign, but we've also worked with local authorities across the 7 northern local authorities in relation to inequalities in vaccination, supporting our most vulnerable, and taking our communities with us. So some real key work there, and also our approach to community testing, which I will come on to shortly. We've continued with our data intelligence analysis and adding in some key data from our local trust, looking at the hospital admissions, and they report that in weekly to the Health Protection Assurance Board, which gives us a really clear picture. We've also had the development of the vaccination programme, which again I'll come back to, and Jane and health colleagues may want to add to it at the end. But we've developed what's called our spike detection tool. So what we look at is right across County Durham, and if any of our rates are higher than what they would be anticipated to be or expected to be, and it can't be explained by an outbreak in a workplace or a care home, for example, then what we will do, we will mobilise a community response. And we did this just before Christmas, in the run up to Christmas in Brasside and Newton Hall, where the rates were up in the 800s per 100,000. And there was a really proactive response from that early detection of rates increasing, from community wardens, from the COVID compliance team visiting shops and supermarkets, from engaging with the local schools and with local elected members to really get key messages out there to try and bring those rates down. We mobilised testing to that part of County Durham as well. So a really kind of coordinated response with community champions engaged too, and we're looking at that in other areas where we have that spike detection tool showing an increase. continue work our settings, so a lot of huge amounts of work with education, because obviously, again, just before Christmas, there was an announcement around schools testing, amount of work taking place over Christmas in relation to that. Then the restrictions came in, so we've been adapting that programme to look at how we support schools working with the DFE in terms of the testing of staff and of children within the education setting, ongoing work with care homes and managing outbreaks, but also particularly that ongoing work around infection prevention control. Community workplaces, we are seeing several outbreaks in workplaces, and with our university, who again, I think their guidance came out on the 30th of December, so they met, I think, on New Year's Day to look at the guidance, and they've now moved to online teaching other than from a very few courses that can be still taught face to face, but they are supporting students who are either here still in the city because they couldn't return home, or for students who did return just before the restrictions came into place. A huge amount of work on testing, so we still have our local testing sites and our mobile testing units, and we are now seeing an increase in that's looking for people who have symptoms and testing on symptoms. And now we're introducing the lateral flow, which is symptom-free testing, and we're looking to target that in particular places, building on the work that's taken place with NHS colleagues, for example. So the university have done some of that. We're looking at schools and we're looking at targeted approach in our communities. Jane has led an approach to looking at the funding, and that work is looking at how the allocations of funding will be attributed to different interventions, and that's certainly something we'll be able to update at the next Health Protection Assurance Board. And from the beginning of January, we became a local tracing partnership aligned to our community hub. So we follow up on any case that the national team hasn't been able to contact after 24 hours. And what we're finding is that having the local voice, the local number, and wrapping around local support. So some of the work that Andy mentioned in terms of some of families who are trying to self-isolate, actually finding themselves in real financial hardship, we're able to offer all of the support that's available to enable them to self-isolate, to stop that onward transmission. And then we now have over 70 COVID champions, and their work is obviously continue, particularly linked to the spike detector tool and getting real insight into local communities. Thanks, Nicole. And obviously, you know, really exciting times in terms of the vaccination programme. 3 vaccines approved. Our vaccination programme began on the 14th of December, starting obviously with our hospital trust, with health and care staff. Got sites now across County Durham, and that's changing, I think, almost on a daily basis, I have to say. But now the rollout with our care home residents, and obviously we've just started the vaccination site at County Hall for frontline social care staff. And as of the 6th of January, and colleagues may, I'm sure, be able to update on that, where was over 28 vaccinations had been administered. Getting that accurate data and having that released nationally remains a challenge, and we continue to really push for that. But a fantastic and amazing effort by colleagues within NHS and social care locally, and volunteers, to ensure that our vaccination programme stays right at the forefront, and we can get our most vulnerable residents and those people working with them vaccinated as soon as possible. And so, Lucy, I think that's it in terms of the overall presentation, and then I think the last slide has got questions from members of the public.
Thank you, Amanda. Has any member got any question for Amanda? If not, can we agree the update, and can we go straight into questions? I know Amanda's now pushing for time. The questions is, I think we've got 3, and I think the first one's to you, Amanda.
So in terms of, and interesting, obviously I've just, in terms of the spikes in community transmission, the spike in Durham City. So what we knew in terms of Durham City, actually it wasn't related to students, which is because we looked at the rate in the 18 to 22s, and it was predominantly more community transmission. And that's really how we're using the spike detector tool, which can really look at the data in a lot more detail and can identify if we think it might be household transmission, if it's attributed to a workplace, where there may either be transmission in the workplace or from people travelling to the workplace. For example, we've had quite some issues of car sharing, for example, but also where we would rule out an outbreak in a care home. And what we found in Durham City was that it was probably that broader community transmission rather than any one particular outbreak, which is why we then mobilised a broader community response. We've repeated that currently in Anfield Plain and Southmore again, where we've seen an increase in those rates, which would be higher than what we'd see against the background rate. And it just adds another layer and to the work that we do from the Health Protection Assurance Board. Thank you.
Thanks, Amanda.
Thanks.
Just before I move on, what I should have said was, within that presentation that you'd done previously, obviously that information contained within the report was correct at the time of writing it. Yeah. However, some information may now be outdated or incorrect given the rate in which things have been changing in response to the pandemic. So I think that I need to make that point. Thanks, Amanda, and thanks for answering that question. I do have a question from Sharon Cattell. If you'd like to ask a question of Amanda, Sharon.
Thank you, Lucy. So thanks very much, Amanda. Always an excellent presentation that brings us as far up to speed, given Lucy's point just there, as we possibly can be. I just wondered, in relation to kind of the max vaccination sites that some of our neighbouring areas have in place at the moment, and I'm sorry if I've missed this detail. I was listening, but are we close to having a mass vaccination site in Durham?
Sharon, I mean, Jane may also, or NHS colleagues may want to come in. There are ongoing discussions which are getting close to agreeing, you know, what a mass vaccination site would look like in Durham and where that might be. So there's definite engagement with colleagues at NHS England in terms of that site. And obviously, as those discussions are taking place, it's ensuring that both our hospital trust and our primary care networks are able to get access to the vaccine to continue the community-led programme as well. But yes, those conversations are kind of hopefully reaching a conclusion soon.
Thank you very much.
Thanks, Amanda. Okay, it takes us on to the second question, and the second question's for Jane. Jane Robinson, what's the current situation in County Durham regarding care homes? Jane.
Thank you, Chair. I think it was relating to visits specifically into care homes. And obviously it's a really important area for residents and their families to be able to visit, and those connections are really important. But visiting should be supported and enabled where it's possible to do so in line with the guidance that's available nationally, and within a care home environment that makes the appropriate measures to kind of manage any risks. And I think that is key in terms of finding the right balance between the benefits of visiting on the wellbeing and the risk of transmission and to social care staff and the clinically vulnerable residents that are there. And as members of the board may know, that it's for each care home and their registered manager to set the visiting policy for that home, and on the basis of a dynamic risk assessment and a number of factors that need to be taken into consideration, and taking regards to the advice from Amanda as the Director of Public Health in County Durham. For all care homes, except in the event of an active outbreak, they should seek to enable outdoor visiting and screened visits. And exceptional circumstances during, for example, the end of life, visits should be enabled where that's safe and practical to do so. Visits should happen in the open air where that's possible, and we recognise some of the challenges, obviously, given the current time of year, and obviously social distancing and visits at windows should be considered as well. And we know that some care providers have used temporary outdoor structures to sometimes facilitate that wherever that's possible. And I think it's very important that the guidance should be followed and providers ensure that they've got all the due processes and risk assessments, etc. in place at that time. And it's also important to note that visiting happens within a wider care home environment where there's the robust infection prevention control measures that are in place, making sure that visitors and staff follow that and the appropriate hand hygiene and PPE, etc. is followed at all time. And it's also important that in the event of an outbreak in a care home that visiting should stop immediately. And we continue to provide support and advice to care homes to enable them to facilitate those risk assessments and support visiting within the context of the guidance where that's possible, Chair.
Thanks, Jane. Leads us on to the third question. What services are the council and partners able to offer people if they have self-isolated due to either COVID positive or being a COVID contact?
Thank you, Chair, and I'm kind of really pleased to say that the council and the partners are able to offer a broad range of services to people who have to self-isolate either due to a confirmed case of COVID-19 or as a contact. I'll just go through a few of those, Chair, if I may, for example, but this isn't an exhaustive list and there will be many other elements that I haven't covered within it. But as an example, we've got the single access point for the COVID-19 support through the County Durham Together Community Hub, which has been a great example of partnership working throughout COVID. There's also food and other support available through the voluntary and community sector established mutual aid groups in the county, with a range of options in terms of access to food. There's also access to medication delivery through local pharmacies and also through the Good Sam NHS Responders Volunteers programme. Additionally, there's fuel vouchers for those individuals that are on a low income. Also test and trace isolation payments, again for people that are on a low income. Additionally and importantly, there's support through befriending services and our Chat Together services, and a real response to feedback we'd had from people who were feeling isolated. So that's been a really important aspect of the support that we're able to offer. Also, the free school meal support for families on low incomes. Advice on the latest guidance and self-isolation dates, which has been really important given the changing guidance and sometimes the complexity and confusion around that. So being able to give that advice is really important. Also advice on benefits, debt and welfare, the Winter Family Grant Scheme, and also, and by no means last on the list of areas that I would go through, Chair, is around the bereavement and mental health support that's available, which is hugely important. As I say, that's not an exhaustive list, but hopefully gives a flavour of the breadth of support that's out there, Chair.
Thank you. A lot of support from what you've said and outlined there, Jane. And moves us on to item 16, any other business? I haven't been informed of any other business. Anyone want to raise anything? It's opportunity.
Just one area from me, Chair, if that's okay.
Andrea?
Thank you. I understand today is Richard Chillery's last board meeting, so I think the board would obviously want to thank Richard for all of his support over the years and obviously wish him well in his future new job. So thank you. I just wanted to raise that.
Thanks for raising it. Obviously we do as a board, and obviously the valued contribution that you've made, Richard. Obviously we'll certainly miss you and miss your input, and on behalf of the board members I wish you the very best in terms of whatever you choose to do going forward. So we'll make a note of that in the minutes and just say thank you on behalf of the Health and Wellbeing Board, Richard.
Thank you, Chair. That's very kind of you. Much appreciated.
Thank you. No other business. Can I just say thank you to everybody for the contribution that you've made today. Thanks very much for all the hard work that's taken place behind the scenes. Thank you to all our partners and colleagues at the front line, and obviously delivering on behalf of our residents of County Durham and further afield as Darlington. So with that, I'll just would like to close the meeting and look forward to the next one.
Thank you.